Hi, I'm Dr. Patrick Foy. If you're listening on Facebook Live, you may have to hear me, you may have to turn on the sound in order to hear me. Right now, I am in Tampa, Florida, at the Tampa International Airport. And the reason that I'm down in Tampa is for a medical conference on tailbone pain or coccyx pain. I'm a medical doctor, I'm a physician, and the director of the Coccyx Pain Center or Tailbone Pain Center at Rutgers, New Jersey Medical School, where I'm on faculty in the Department of Physical Medicine and Rehabilitation. And here I am, I'm going to flip this here at Tampa International Airport, but actually what I'm looking to show you is the cover of this booklet from the course that I was just at here in Tampa on coccyx pain evaluation and treatment. And basically this is a course predominantly meant for physical therapists and specifically for physical therapists that specialize in treating tailbone pain or coccyx pain. So flip this around again, so hopefully you can still see me and hear me okay. But basically the conference was all about treating tailbone pain. And I've been treating tailbone pain for close to 20 years now, and again running the Tailbone Pain Center, which is online at tailbonedoctor.com. But what I do often is evaluating for musculoskeletal abnormalities, bone spurs, fractures, cancers, malignancies, dislocations, dynamic instability, a whole variety of different causes of tailbone pain. But sometimes the issue can be that there is a muscular problem within the pelvic floor, either that's causing the patient's primary pain or that may be secondary. The person may have muscle spasm or muscle guarding at the tailbone, or in response rather to pain at the tailbone. They'll have muscles in the area. The pelvic floor muscles may go into sort of a spasm or a guarding. The pelvic floor is sort of like a hammock or sling on the bottom of the pelvis. It's multiple layers of muscles that are there. And just as you can get a muscle spasm, within your neck or shoulder or other areas, it's possible to have muscle spasms at the coccyx region as well in the pelvic floor muscles. And really, this conference was geared predominantly for physical therapists. I was the only physician or medical doctor who was there. Geared predominantly for physical therapists who were treating pelvic floor pain from a variety of causes. So I was honored to be able to give a lecture, or talk to the group from a medical management physician perspective, but more importantly was also honored to be there to learn more about what physical therapists can do to help with patients with a variety of pelvic floor pain, and particularly some of the associated issues that may happen for patients with coccyx pain. So that was really the idea of the conference. I've been down here for the past 2 days. I'm actually just at Tampa International Airport waiting for my flight back to New Jersey. And right now it is Sunday evening, March the 26th. So I'll post some more in the weeks to come in terms of some of the things that I've learned and my observations from the conference. Certainly for those of you who have not only tailbone pain, but especially if you have associated pain within the pelvic floor, for some women that may be pain during intercourse or bowel or bladder, spasm and irritability and things of that nature. Often it can be very, very helpful to see a physical therapist that specializes, particularly with expertise in treating pelvic floor dysfunctions, so pelvic floor problems. And that can often involve using manual or hands-on techniques in order to work at identifying muscle groups that are painful and working hands-on techniques to relieve those symptoms. Sometimes that's through an intravaginal approach, sometimes that is through a intrarectal approach, sometimes that can be through an external approach. And I am seeing some comments on the video, so thanks for those who are commenting. I greatly appreciate that. And for those of you who may not see this video live, it will remain on YouTube and on Facebook rather. But you can, if you have questions about this topic or other topics related to tailbone pain, certainly you can post those down below. If you write a question on there, I'll be able to see that if you do that now, or even if you do that in the future after this is no longer live. I'll be able to see your questions and give you responses. I can't give actual medical advice, of course, on Facebook, but if you have a question of a general nature, certainly I'd be happy to share my perspectives on that with you. The things I would say in terms of this conference was terrific. There were a couple of dozen physical therapists specifically focused on pelvic floor who were here in Tampa for the past 2 days, and it was great to meet them. It was they had many years of experience among them in treating patients with a variety of pelvic floor abnormalities and painful conditions. So it was terrific to meet with them, talk with them, share my perspectives with them, and very importantly, of course, is to hear their perspectives on some of the issues and problems and approaches that they use for patients as well. So I need to catch my flight, so I'm going to sign off for now. But if you post questions or comments down below, I'll be sure to take a look at those, as you post them. So, okay, thank you, folks. All right, bye bye.